Hi, I'm back with another Ask Augustine. This one comes from Hattie. Hattie asks, after reading our blog post and YouTube video about sterilization of instruments, they ask, I'm looking for a reference for how long oven sterilized instruments remain sterile prior to use, and I'm assuming opening the package. According to the CDC, sterilization is now considered event related. So items are considered sterile unless something else compromises that, like a package being opened or being stored near non-sterile items. So what this means for midwifery application is because many times our sterilized instrument packs or suture packs are put in and out of birth bags, in and out of prenatal bags. They've maybe taken out at a client's house, and if there's a transport, they're put back in the case. That's a lot of exposure, and so it is a generally accepted practice to date each package that's sterilized and then re-sterilize every 30 days in unused, unbroken, sealed packages. And then the way to do that so that it is trackable is to use some indicator tape. That's the masking tape that has the bars on it. Those change color when they're exposed to heat. And so they're a really effective use for oven sterilization techniques. And so you would just take a little new strip of that indicator tape, place it on the sealed, already sterilized package, and then re-sterilize it with a new date. And that way you can keep track of your instruments, you can ensure they're sterile. If you'd like to read more, understand more about the difference between cleaning, disinfection, and sterilization, please check out the blog post on our website, midwiferywisdom.com, or find us here on YouTube, and you can watch a little video about that. Sterilization is, it's an interesting thing, and I'll kind of go off on a tangent a bit, but during the pandemic, we saw a lot of what has now been coined as the term hygiene theater. And in some ways, that is what is happening with the sterilization of instruments for birth. That doesn't mean they shouldn't be as clean/sterile as you can make them to use them. But in reality, all that you're trying to do is make sure you don't transfer any organisms, right? So the general rule of thumb is for external products like blood pressure cuffs, they're not sterilized, they're not even disinfected. They just need to be clean and dry to go between patients. Then when we have things touching mucous membranes, they need to be disinfected. And only things that actually touch the interior of the body cavity need to be sterile. So just keep that in mind. Disinfected is fine. And if you ever have a question, or say you're in a huge hurry and you are transporting, or you just caught a baby on the side of the road or something like that, you can disinfect on the fly by using alcohol on your instruments. So you can use alcohol pads to rub the teeth of your instruments and consider them absolutely disinfected enough to cut and clamp a cord. Definitely make every effort to make your instruments as clean/disinfected/sterilized as possible. But remember that when you're cutting a cord, you are dealing with an external surface space at that point. And so since it is away from the baby's body and it is away from the birther's body, it is perfectly appropriate for those instruments to be disinfected. For suturing, we are passing hopefully a sterile needle using a sterile needle drivers into the body cavity. So suturing instruments are very important that they stay sterile. Cord clamping instruments, slightly less so. Hopefully that helps and helps you make the best of the challenges of running a midwifery business, keeping your instruments with you and available. And if any of you have taken workshops from me, then you know the only two reasons that we bring instruments that are sterile and in a package and ready at a moment's notice on the tray next to you during birth is for two reasons. We'll challenge you to leave those two reasons in the chat below and help teach each other, because most births Baby and placenta can be cuddled together for hours and no need to hurry and cut the cord. So there's only 2 reasons that we have sterile instruments at the ready. Go ahead and leave that in the chat. And as always, if you have questions that you'd like me to answer on air, send us an hashtag AskAugustine on social media, on the website, or on YouTube. All right, have a great day, y'all.